My name's Sanbrita Mondal. I'm an optometrist at UW Health and Director of Low Vision Services at our eye clinics. So I want to thank you all for referring your patients to us in the low vision clinic. We have been receiving a lot more outside referrals since about a year ago. So it goes to show that you're all very conscious of how our patients are functioning with their vision loss, and we continue to care for them by referring them further on to other services as well. So what we do here is mostly low vision optometry, but we will be expanding our clinics fairly soon in the near future, so you will probably hear an announcement about that. But right now we do mainly a functional vision assessment. We assess their distance and near acuity, their contrast, their visual field. We try to map their scotomas, and we also do a lighting assessment, which I have right here, which is like the Lux IQ 2 meter. It also does a tint assessment as well. And so this gives us more information about what their goals are, how we can help them meet their goals, and then either we dispense devices and make recommendations, or we also refer them out to the community, to Low Vision Occupational Therapy, the Wisconsin Council for the Blind, the Office for the Blind. We try to keep patients locally, and we do have a lot of patients who travel from very far away to see us here in Madison. So if you're a local optometrist who does some low vision, I would be really happy to talk to you and get your information so that we can collaborate on patient care to help them get the care they need, but in a more convenient setting as well. We are planning to expand our low vision clinic. By the end of this year, we will have low vision occupational therapy present in our clinic, and we will have a full functioning low vision rehabilitation center where patients will work with occupational therapy on activities of daily living and instrumental activities of daily living to improve independence. We will also have facilities to do driving assessments with the occupational therapist, so our own ophthalmologists and optometrists are more comfortable filling out any driver's license form. So if that's something that you do not have in your location that you're interested in referring to us, we'll be more than happy to help. Please do keep in mind, though, a lot of occupational therapists do driver's assessments, so you can always find out locally if there's an occupational therapist who has that facility and does that. We also will be having a social worker in person in our low vision clinic starting mid-September, and we are very excited. We've been collaborating with her for the past 4 years, but now it'll be nice to have her interact with patients in person. We're also doing a lot more research. We currently are collaborating with the Department of Computer Science and Department of Engineering in coming up with technology in terms of virtual and augmented reality to help people maintain their independence. So if you have any patients who are interested in future low vision studies, please have them contact us. We'll be happy to get them set up. We're also doing a low vision, or actually we're doing a visual impairment registry. So we'd like to get an understanding of how many people we have in our communities who do suffer from vision loss and it's affecting them in their life, so that we can have a good database to find how we can get more resources as well as more healthcare partnerships to help these patients in need. As you know, there's really not much help in terms of healthcare coverage as well as rehabilitation personnel and low vision specialists in the community. So as the years go by, this need will be greatly increased, and so we definitely want to be able to address that situation sooner than later. Because we have an increase in referrals from our community, we do have a new process in place just to make it all formalized so that we have enough information to see the patient just for a low vision exam. As you may be aware, we usually don't dilate a patient during the low vision visit, as we want to keep their functional vision intact to get a better understanding of it. And these visits do take almost up to 2 hours at a time. So you will notice that when you do refer a patient, you will receive a form faxed back to you to send us the patient's most recent eye exam, as well as any imaging such as visual fields are the most useful. I know sometimes the OCT or fundus photos, because they come back in black and white, are not so useful, which is fine if you don't have them or can't send a digital copy. But if you did do a field on the patient, it really helps us understand how we might help them with their need. But definitely their latest eye exam, that includes their acuity and the fact that they had a dilation in the past year, really helps us. Or else we can always schedule them with one of our optometrists and staff to do a dilated eye exam if the patient hasn't had one in over a year. So you'll just be patient with our paperwork. But once we get everything online, we do contact the patient right away, and we schedule them as soon as we can. We have also expanded our days in the low vision clinic. Prior to this year, we used to offer low vision only 1 day a week. Now we offer it 2 days a week. So there is more availability and less wait time for patients to be seen.